Hello, everybody, and welcome to Tough to Treat. This is Susan Clinton, one of your co-hosts, and today we're going to be talking about shoulder pain and how we can weave through the idea that maybe a biomechanical diagnosis isn't going to really render a good solution to pain. Have a listen, tell us what you think. I hope everybody is settling in and getting ready for the holiday season. It is early November here, and I am recording this introduction from Colorado, where the skies are clear and very cold. Thanksgiving is coming, and Erica and I are both very grateful and thankful for the listening that we've had from everybody and all of the wonderful comments. Keep them coming and let us know what you think. Thank you. Hello, everybody. This is Tough to Treat, and I'm Susan Clinton, along with my co-host, Erica Mello.
Hey, Susan. How are you?
I am good, Erica. As we're getting ready to lay this podcast down, Erica and I are both headed off to the Denver region for the annual Private Practice Section Conference, and I'm actually going up a few days early to do some teaching in the area, too. So it's been a crazy fall for, I think, both of us. We both have moving parts. Erica has a brand new book out, Why Do I Hurt? I'm going to give her a plug on that one because it's absolutely fantastic. And I think what's really cool about the book, Erica, is that it really kind of taught, the way it's laid down is very much how we go through the podcast.
Yes.
You know, finding, clients complain of something and helping them find, take a couple of steps back and go, what else really needs to be considered here to get people to look at things a little bit differently and to get PTs to start considering that there may be much more of a systems approach rather than a regional approach that can be quite helpful for some of our clients.
Yep. It's funny when I did each chapter or the patient stories or the client stories, I wanted to make sure I made each chapter the same in terms of organization and structure. So it talks about what I found, what worked, and I hope everybody enjoys it. And it was a labor of love, and it took me a long time, but I am glad it's finished. And now it's
out there.
Yes, it's out there. I know. Someone said, you can call yourself an author and an expert now. I said, I can. And they're like, yes. So
you have written the book.
Yes. So it'd be great if anybody has any questions about it, feel free to contact me. But I'm glad. So it's now onto the marketing of the book. So that's
yes.
That's the tough part.
And I know that I think everybody knows we have a YouTube channel as well.
Yes.
Tough to Treat, and we also have a website. And on both of them, we're a little slow to get them out there, but we will get them out there. Are some planned videos about some of the things that we have actually talked about in our podcast.
Yes.
I know Erica's going to do one on some facilitation. That she did, and I've got a couple of videos. I've got a podcast that we're going to do in a few weeks here about a client, and I actually was smart enough to take some video while I was working with her, so I wouldn't have to repeat this. Trying to get a little smarter about how we do things. So we do it. We do have that, and if there's suggestions that you have of some things you want us to demonstrate, we're happy to do that. So shoot us some suggestions, and we'll see what we can do across 2019 to get some of those things out there for you.
Yes, we have a sign-up form on the website. My assistant, I think, we have two we call opt-ins, and one's going to be a sneak chapter of my book, and the other are two beautiful things that Susan did regarding sleep, and it's really important. I was reading those documents. I had no idea about sleep and pain and it's just amazing. And so those are going to be out there, to sort of click on and read. And I get asked a lot via email about courses we've taken and what's helped us the most. And I think at some point going into 2019, we'll just add something to the website on just certain courses that we've taken in one central location. So a lot of things happening, so just bear with us.
Yep. Okay, let's get to the real meat of what we do here. Let's talk about my client that I have. This lady is a 46-year-old female presenting with right shoulder pain. She was referred to me by her family. I have treated her entire family. in the region, and she kind of came to me with a lot of skepticism and said, I've got high expectations because they rave about you, but I could tell she was just like, I don't know if I really
Mhm.
even want you to come close. So we just sat and visited for a while, and I said, just tell me the story, tell me what's going on, what's happening. She said she had a history of a labral tear 2 years ago, and she'd really never had shoulder problems before that, and she doesn't really even know the mechanism of it, but she said somehow some of my crazy workout routines, I must have done something because they told me I had a labral tear.
Mhm.
And I said, so what did they do? And she said nothing. They just said to just kind of take it easy and see how I feel. And she said, she goes, there's things I can do and things I can't do, but for the most part, it's been okay. um, and I said, well, what's happening now? Why now? Why me? Why did you
Mhm.
decide to do this? And this is where it got a little interesting. She said, well, basically about 4 to 6 months ago, my pain became much more intense.
Hmm.
And quite frankly, it's starting to worry me now. And
Hmm.
I said, well, can you describe what that means? What is your pain? What is the intensity? What is happening here? She said that it hurts more often than not. And now I'm having night pain, and I can't sleep on my right side. And so I went back to the doctor, and they wanted to do another MRI. And I was wondering why they wanted to do another MRI. And they didn't really have a great answer for me other than, we just want to see if maybe something had progressed with her labral tear. And then she said, depending upon what the MRI shows, they want to do a plasma-rich injection into my biceps tendon.
Oh boy. Okay.
Kind of the crazy story. So I started kind of thinking about this, and I have a little inside information because I treat her entire family.
Mm.
And in her family, her sister has MS, and her
Okay.
mom and this lady that has a shoulder pain both have pretty significant migraines
Hmm.
that are more seasonal than cyclical.
Okay. You mean like
And
in as in summer versus winter and things like that?
right,
Yeah.
yeah, like as in change, like the fall change of the
Yeah.
weather,
Weather. Yep.
makes them worse. The dad has some autoimmune issues as well.
Yep.
So that so I'm kind of sitting here thinking about this, and I'm thinking about shoulder pain and intensity and nighttime, and I think everybody out there
Mm.
hopefully is kind of following. Is this
Mhm.
some sort of autoimmunity frozen shoulder?
Mhm. Mhm.
That's beginning to creep in. So I kind of had that on the back of my mind as I was talking to her and listening to her and listening to some of the challenges that she had. There was also a tremendous amount of fear. I don't When I go to the gym, I don't lean over to do a row because I don't want my shoulder to fall out of joint.
Oh boy.
So I asked her, I said, have you ever had any reason to feel that your shoulder, has anything ever happened that made you feel like it fell out of joint? And she said, no, but I don't want it to. Because my understanding is with a labral tear, it clunks in and out. And it's like, yeah.
Right, from Dr. Internet or just from people who've told her those things, you know?
People who have told her those things. Yeah,
Ah,
exactly. So very protective. She goes, I don't even lift the garbage can. I make my son do all the lifting of the groceries in and out of the house.
oh gosh.
And she was like, she would hold her arm, and and then she took her arm and she put it out in front of her body with a straight elbow,
Yeah.
just straight forward. She
Mhm.
said, and I don't do that because it hurts so bad when I do that. It's like, okay, so I'm still kind of listening to this going, doesn't sound very capsular, but and
Yeah,
then she
right.
said this is what I really can't do. And she reached me, she said, I can't get my hand behind, like, to pull up my pants,
Right,
in the
right.
back. And it's
Yeah.
like, okay, so she's kind of, we talked a little bit more. I asked her about any kind of medications and things she's on. She says, they give me all kinds of things for migraines. None of them work. What has worked and continues to work is if I do regular Botox injections.
Yep.
That seems to help me the most. But mostly she says what I have to do is go lay down and turn off the lights and
Mm.
have everything quiet down for at least 24 to 48 hours.
Mm-hmm.
And
It's almost
that's how she deals with her migraines.
Yeah, it's almost like with the shoulder, she's almost like disassociating the body part from the rest of her system,
Hmm.
right?
Right,
You know, wow.
right. So part of me is, already thinking, hmm, is this really in the shoulder?
Yeah, doesn't sound like it, at least from what you said so
Or
far.
right, or is it coming from somewhere else?
Yeah,
And how much of the systemic stuff is a piece of this?
right.
And nobody's really connected those dots with her at
Yeah.
any point. So I just kind of asked some general questions, about, her sister and, migraines from her mom and her dad and some of the stuff that was going on. I just asked her, I said, have you or anybody in your family been tested for any autoimmunities? And she said, yes, we all have an endocrinologist, and, things don't really, she goes, it's murky. They can't really pinpoint anything with me, but my kids so far are all okay. So, you know,
Okay.
nothing's showing up there right now.
Mm-hmm.
And, but she said it was murky. And I said, well, what does that mean? She goes, well, sometimes my C-reactive protein is high and sometimes it's not.
Oh,
And I said, do you remember when you had that tested? And she said, usually I go to the endocrinologist when I have time. And I said, well, have you ever gone when you're having pain or headaches or any kind of a flare? And she said, I don't really know if I can answer that. She said, because you make an appointment 6 months out, because that's how long it takes to get in.
mm-hmm.
And, then I do the blood work before I go, and they look at everything, and then they, you
Right,
know, kind of talk about, different things.
right.
So, because oftentimes the C-reactive protein won't be elevated if you're not in a flare,
Yeah, totally. And it's a
you
blood,
know.
it's one blood test. I mean,
Right.
yeah.
Right. The RA factors have always been negative,
Yep.
and she's definitely negative for MS and lupus,
Okay.
and those
That's
things.
good to answer that.
So, and she is not diabetic either. She's not a juvenile onset or anything like that as well. So some of those things that you think about, with the kind of shoulder pain stuff that comes
Yeah.
up, could be sometimes can be associated with juvenile onset diabetics as they
Right.
age,
Yeah.
and
What is she,
kind of move through that. Yes,
what does she do for a living?
she works as an executive at a large food operations
Okay.
plant.
Okay.
It's a
So,
family owned and family run business.
okay. So no lifting or anything like that at work,
No,
mostly desk
but
jobs.
she
Okay.
loves to exercise, and she's a
Yeah.
crazy avid exerciser. So she goes to the gym and does all kinds of things, but leaves her right arm out of it.
How's her body weight? Is
Her
she
but
normal
she
body weight?
Yeah, very normal, very
Okay.
fit, very healthy, individual. If you
Okay.
passed her on the street, you would never know anything was wrong.
Okay. Is she still married?
She is still married.
Okay.
Hmm.
Okay. I'm just
No
adding.
complications with her pregnancies. We talked about all of that. I asked her about onset of symptoms, when she started with the right shoulder pain. Could she remember back to any time before, she was told she had a labral tear? Like, how long had that really been going on? Because all she told me was 2 years ago they told her she had a labral tear. So I wanted her to kind of track back and let me know. Um, you know, my knee hurt once upon a time here, my right shoulder hurt here, headaches started when I was 37.
Mm,
Um, so that, the headaches did start after her second child within that 2-year period where
mhm,
autoimmunity is pretty ripe to show itself. But
mhm.
the shoulder pain didn't show up until, she said, probably about 2.5 years ago, a half a year of noticing problems at the gym until she was diagnosed with the labral tear. So that's
Okay.
kind of where we were and
Okay.
where we go. So, Erica, any thoughts you have?
The way when you were talking about holding her arm out, she was very, just in the way she was speaking and what you said so far, she seems very protective of her body part. Almost like I'm thinking back to some of the David Butler things I learned in Explain Pain. She's really, is going to be lit up in her brain, and
Mm-hmm.
she's disassociating it from the rest of her body. It's like an
Mm-hmm.
appendage,
Mm-hmm.
and she's not integrating it as part of her whole system.
Mm-hmm.
And she's got normal body weight. The psychosocial factors seem, from what you've said so far, seem okay. I think she's very focused. She doesn't smoke, right? No
Nope.
smoking,
No
nothing like that,
smoking.
right?
No.
Nothing Pancoast tumor or anything like that. So, um, I think just from what you said so far is she obviously has this heightened nervous system, Okay.
Hmm.
And I think that that's probably part of the issue. Did anybody ever recommend physical therapy before? Like, besides, she was referred by her family, but did a doctor
Oh
or
yeah,
anything?
yeah. That's a great point. I forgot to bring that up. She did go to physical therapy 3 times,
Okay.
and won't go back because what they did was not helpful.
3 times. Okay.
She tried. She
So,
tried to go. She went 3 different episodes to physical therapy.
okay. I
Hmm.
got it. Okay.
Yeah.
So, she seems very much, obviously upset, and but was she resigned to the fact that a PRP injection was going to be the best thing that ever happened to her? Or that was just upset, she just said that as a matter of fact?
She's more or less said it as a matter of fact with great trepidation, like, I don't know if I really want this or not. She wanted to understand more about what that would mean. She
Okay.
feels like that they're just kind of shooting in the dark. And so she doesn't want to have something that would make things worse.
Okay, so I think given her whole family situation and the history of migraines, um, I think a lot has to do with the heightened nervous system and maybe a little bit of, so far, just a little bit of obvious shoulder issue. She can't get her hand behind her back, but it's this appendage. She needs to integrate the body part
Hmm.
back into her system. That's what I'm thinking so far. So
Yeah, yeah, exactly. And that was kind of the way that I decided to approach it, was like, okay, let's explore some movement and see what she's really comfortable with as we kind of, dispel a little bit of myths. What I really wanted to do with her more than anything else before I even went near her was to just unscare her. In
yeah,
Sandy Hilton's words,
yeah.
I spend my whole day unscaring people.
Hmm.
And I just wanted to help kind of get her to be able to voice her fears so that she could
Hmm.
start looking at things tangibly and beginning to understand that maybe this fear, is based on this fear is based on that, so that she could get a bit of a handle on it and start having the thoughts bounce around in her head so much. So we talked a little bit more. I had her do some, I said, just move your arm in a way that doesn't bring on any of your symptoms. And she could actually move it pretty well. If she went straight out in front of her body with her elbows straight, that bothered her. So I said, well, just go lower and find the edge where it doesn't hurt. And so she kind of explored that a little bit, and she could get her arm up to the side some and around. And she kind of got a little bit more comfortable and started tracking just a little bit more. And but in that, I could see some external rotation, I could see some internal rotation. External rotation was um, you know interesting. She had much more external rotation than internal rotation, which is a little weird. When I get into the exam, you'll
Hmm.
kind of see. And so, but this is, this was active range. So this was her willingness to move. So we have to
Yeah.
kind of keep that, in our, that maybe they can move a lot into that direction, but maybe they can't. But this is what she was willing to do. She was showing
Hmm.
me the willingness of her movement system.
Hmm.
And no numbness, no tingling in the hand, nothing brought on any kind of other symptoms anywhere else in her body. So, this was kind of a safe area for her to be in.
Hmm.
And so I just went behind her while she was moving her arm, and I said, I'm just going to just put my hands, on the side of your head, and you just let me know how this feels, if you're okay with it, if you're not okay with it. I just, so all I did was just come in, to where I could actually touch, her head on both sides. And I just gave not a tremendous amount of traction, but just a little bit, just
Hmm.
enough to kind of see if I could start to engage with that nervous system and see if, and I just kept having her move her arm. If your arm is not hurting and you're not tired, just go ahead and keep exploring, that movement that feels good. She did get a little, she was willing to move her arm a little bit more with the traction.
Why did you
So,
go for the head?
because I just felt like that the way that she was moving in and out of positions that if she was worried about clunking and
Hmm.
or positional faults in her shoulder, she wouldn't have done those movements. She was taking her
Got it.
arm back behind her body. She was taking her arm, she was bringing her hand up and back.
Hmm.
She was actually, we kind of did some semi kind of like, if you had to push the air away, so
I
she
love
kind of
it.
like pulled her hand up, and so we were playing about,
Like
what would happen if
imagery.
you just push the air away, the air away. And so she was willing to do these things that she told me she was worried about.
That's great.
So I
Yeah.
thought, okay, let's just see what happens with a little bit of traction. I thought maybe it'll make the movements worse, or maybe it'll make them better. I have no idea. I just thought this is where I need to go
Yep.
with her. So I did.
I like
And
the imagery. That's great.
yeah.
Yep.
And so we continued to do a few things like that. Like I said, the shoulder movement was a little bit better, but quite frankly, at this point, she was getting braver with her movements and understood them. So I don't know if it was because I put a little traction on her neck or not, quite frankly.
Right.
There was no real, like, whoa, that's really better. I mean, she probably would have continued to improve had she sat there just, moving her arm around.
Yep.
So I thought, well, I'm not gonna go into another system that's super sensitized right now. It seems like probably going through this is the one time where I ended up back at the joint of where the complaints were. The neck needs to be part of this piece at some point, but not
Yep.
that day.
Yes.
Because it was like, okay, we know we have headaches and sensitivity and migraines and that stuff, and now we've got the shoulder issue going on that's gotten worse at nighttime. I'm still kind of thinking some physiology here, some systemic stuff and things like that.
Yep.
Because oftentimes it doesn't have to present as a true frozen shoulder. Frozen shoulders present as pain. Pain, and then they start lacking range, and then they freeze up, and then they come out of it, and they start gaining range and go through the pain, and then it gets better, and then their shoulder is moving again. So they have that kind of predicted pathway. And she did have a lot of pain, but it was also 3 to 6 months. So if it had been, it started kind of making me feel like, oh, we've been in the pain piece a lot longer.
Yeah.
And she really has some pretty decent movement. It's not the best, but it's fear-based more than it was. It seemed to me with her willingness to move more than it was capsular or connective tissue-based.
Right.
Or maybe even what we don't know about frozen shoulder anymore is maybe does it really freeze, or does the brain just clamp down and protect it so hard?
Exactly.
Until it gets through the the inflammatory episode, and then it just remains still for a while until the brain kind of allows it to start moving again. We don't know. I mean, I just think it's fascinating.
Yeah.
So what I did was I just had her, I had her lay down, and I told her, we're going to move your arm a little bit, and I just want to see where we can get it to. And she was able to take it up to about 120 degrees of flexion.
Oh, that's great.
Yeah, laying down, she was a little more comfortable. She was, and kind of an empty infield, so it wasn't like, that's it, that's as far as it's going to go.
Yeah.
So you could tell it was kind of more of a protective, guarded kind of like, okay, right there, that's pretty good. Thank you. About 20 to 30 degrees of external rotation, and a pretty significant loss of internal rotation.
Okay.
And again, that had a bit of a muscle guarding, muscle spasm infill to it. And then, some tenderness across the biceps tendon, all very predictable things, which didn't surprise me at all. And, but I had her laying down, and I thought, okay, well, let's just start with scapular movement and get that rolling and going. And so as she would take her scapula and retract it, and or retract it with a downward glide.
In supine, you're doing this.
In supine, yeah. Okay. So my hand, so basically for the group out there listening, I basically had a hold of her arm with my right hand, my left hand, because it was her right shoulder. My left hand went down underneath the scapula on the bed.
Got it.
So what I did was I just worked with trying to, help her kind of like actively, like, come on, bring it this way. When she went into retraction and downward glide, or the inferior glide, that brought her symptoms on.
Oh, interesting.
Yeah. And so kind of maybe track back up to thinking a little bit about, okay, there is probably a little bit of a neural tension.
You took the words out of my mouth. I was
know,
thinking
right?
exactly the same thing. You're tensioning something up there in the nervous system.
Exactly. And it was not the shoulder that was going to bring it on. It was coming from, through the scapula and that part of the cervical plexus back there, which I thought was really interesting, and adding side bending maybe made it a little bit more worse, but what really got it was that retraction inferior glide.
Wow.
Which was interesting because it was the position that she liked to kind of hold herself in.
Did you feel any muscles turn on or anything clamp up when she did that? Or reduction of her symptoms?
Just reproduction of her symptoms.
Okay.
So what I decided to do, because that's the position your shoulder blade needs to get into to bring your arm behind your back. It has
Mhm.
to retract and
Yep.
downward, inferior glide.
Yep.
So I thought, okay, let's just take a look at a couple of things. So I just decided to come underneath her axilla into her subscapularis. And so I had her arm cradled at that point, and I was into her axilla, on her
Mhm.
subscapularis, and we
Yep.
continued to downward glide and
Yep.
retract and work on that. And, just encouraging the subscap. Actually, it was like overworking, which is
Mhm.
interesting because it's an internal
Internal
rotator, but
rotator.
internal rotation was hard for her.
Exactly. I was just thinking that. Yeah.
So I
Strange.
don't have words for it. I can just tell you that when I began to work the two ends
Mhm.
between the scapula and the inferior humeral area,
Mhm.
that we began to make progress. And
You
her
mean
pain went down substantially.
just moving the scapula on the thorax, like upward rotation, superiorly, retraction, protraction, that type of thing?
Exactly. And
Okay.
exactly. And just kind of maintaining, the traction force on the opposite end through the inferior humeral region around the area of the subscap.
Okay.
So
So
I,
you're
mm-hmm.
no, go ahead.
No, that's okay. So I think what I was on the brachial plexus.
Got it. So one hand was on the humerus, on the subscap, and the other hand was on the scapula, moving both ends simultaneously, tractioning the humeral part subscap, and then moving the
Yeah,
scapula. Okay,
exactly.
got it.
So I think what I ended up, because it just dawned on me at that point that it's like, oh, this is neural tension, but I think it's
Yeah.
more in the brachial plexus and perhaps not
Mm,
in the cervical.
right.
Now she probably
Yes.
has cervical, tensioning. I don't know.
Hmm.
Maybe this is running the cervical tension piece too. Interesting, but I thought, if she's going to get Botox, I wonder what would happen if she got it into her subscap instead
Oh,
of her
that's
suboccipital.
exactly. Oh, that's hysterical. I mean, when you're pulling on, when you're doing an inferior glide like that, you're tensioning something up in that clavipectoral, that whole area up
Hmm.
there. So
Hmm.
it very well could be
Right.
that'd
So
be
the
interesting.
gentle motions like that, adding the breathing, talking, and we just kind of, it took about 15 minutes to really feel everything kind of just let go.
Hmm.
And she wasn't having much of a pain experience at all. And she was very happy. She was like, this feels really good. What can I do at
Mm.
home? And I said,
Yep.
okay, we'll get to the home program. But first, let's sit back up and just kind of explore that motion again.
Yep.
But basically, what I wanted her to do was, I said, can you bring your arm out in front of you again? And she just shot it out there and she goes, it doesn't hurt. And then I was able to take my two fingers and put it on her wrist to like kind of pressure it, so she had to work harder. And she goes, I'm not having any pain. So it was like,
Oh, wait,
she
wait. Say
was,
that again.
yeah. So she was able to put her arm out in front of her with her elbow
Yep.
straight,
Yep.
and that didn't hurt. So I came on top of her wrist to
Yep.
give her some downward pressure that she would have to work against.
Yeah. Yeah.
And she said, I'm not having any pain at all.
And that's after all the scap thoracic. Very interesting.
Hmm.
Huh.
So I sent her home with, I took a washcloth and I wadded it up because washcloths are soft, and I don't
Hmm.
really have a ball small enough to get up underneath into the axilla.
Yeah. 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 That's
So,
tough.
and everybody's got a washcloth at home. So I took a rubber band and wadded up a washcloth, and I said, stick this under your arm, and and I said, and start moving your scapula around.
So stick it literally in the
In
axilla.
the axilla.
Got
It
it.
was up against, where my hand was.
Yeah.
And
Yeah.
then
Yeah.
she just moved her, I just had her go home and just move her shoulder around,
Oh, I love
so
it.
that all of that kind of stuff, she was able to get in and mobilize that tissue and, feel better. And I said, and then afterwards, you do that for, just till it feels a little bit better. It'll probably be a little tender when you first go in, so just respect that
Hmm.
and get it moving and then see what happens. And then you're home, after that, you're just to explore motion.
Right.
So, and so that's how she went home. And I sent her some resources on, kind of nebulous shoulder pain and autoimmunity. And I said, just things to think about and, keep in your back pocket.
Hmm.
That, some of this may have a little bit of more of a physiological kind of origin rather than a musculoskeletal. So
Hmm.
that could be a piece of the driver, but I said it's not the only thing.
Yep.
It's probably everything altogether. So she got the whole idea about being afraid to move. I want to move, but I have been afraid to move. And in fact, I've limited my movement so bad, it's like probably not good for me now.
Yep.
So she
Yep.
loved the exploring the motion. She loved the moving without symptoms. That felt good to her. And she loved the idea that she could get her arm up and around in a lot of different positions and stuff like that without
Yep.
feeling like that her shoulder was going to come out of joint. So we kind of
Right.
conquered a few things in that first thing.
That's
Um,
great.
I saw her 2 or 3 more times.
Mm-hmm.
And at this point, we kept progressing to where we'd put instead of pushing the air, we started putting the hands on the wall and it's going to push the wall,
Mm-hmm.
started to get some closed chain work going in there.
Mm-hmm.
And I had her explore doing that in a lot of different positions and directions and, even partial push-ups and things as long as she was non-symptomatic. And I liked that because that pulled the wrist into, to extension. So if we
Mm-hmm.
were going to be challenging the tension, through the lower part of the, that long tracking nervous system into the arm, that was a good way to kind of get it there and have her explore the movement on that, fixed distal end.
Mm-hmm.
And,
Mm-hmm.
then I saw her the third time, she was doing planks and doing planks with shoulder taps. So she
Oh
was
my
like
Lord.
planking onto one arm. So this is how fast she progressed.
Jeepers. That's a lot.
I
That's
know it was
no load
just
to full load.
yep, it was just amazing to me. Um, that this just kind of shows you how much fear can
I was just, yep.
can really interfere with somebody over time. And she is exploring a little bit more about maybe some other autoimmune things that might be connected with her headaches. And so
Mm-hmm.
she's got a little bit of work to do, and I gave her a referral to a functional medicine doctor that
Mm-hmm.
I thought might do some different kinds of blood work. I said, go in, tell your story. I know this physician is amazing. And so I got an email from her that thyroid is super low, vitamin D is down very low, and some other things. And so they're going to be in some B's. They're going to be working on trying to kind of bring that level, bring those levels up a little bit and see if that helps some with the headaches and some of
Yep.
the other kind of
Yeah.
off and on small joint pain and things that she has. So, but
Mm-hmm.
she's doing very well, and I just thought it was an interesting story to tell.
Oh my God, it's fabulous. I mean, you think about, because I have a couple patients right now who have a quote unquote frozen shoulder, and eh, you have to, and a lot of them are just afraid to move because they don't know why they get frozen shoulder or whatever with stiff shoulders,
Yeah.
same thing.
Hmm.
Why do they get that? And I think that exploring that movement, especially when she's in a non-threatening position, lying on her back, your hands are cradling her arm. It's like you're protecting the arm yourself as the therapist. You're supporting her literally and
Hmm.
figuratively while she's able to move the arm in a non-threatening way. And I think I think this is great because when you first started talking about it, I'm like, well, is it a shoulder problem? Is it not a shoulder problem? She has so much history of and it people with low thyroid, low vitamin D, it's very common, but it's also common in people who have migraines
Yeah.
because that's my issue as well. So
Hmm.
I think that uh, getting her just moving in a supine position, even in a sideline position, just to get her out of her sitting and raising her arm, that whole big red light area in her
Hmm.
brain, and putting it in a really unloaded anti-gravity position is a great idea. And it's really more for the fear. And so, I mean, at this point, did she have a shoulder problem? I don't think so. It was more
Hmm.
fear from what you're telling me, but
And a
I
sensitive nervous system.
a
Yeah.
sensitive nervous
Yeah.
system, right?
Yeah.
Would she have
So
adhesive
the two things
capsulitis? No.
together. Yeah.
Yeah.
No,
Yeah.
I did.
No.
I couldn't find, I didn't do a crank test on her. I wasn't going to do a
Yeah.
speeds test on
No.
her.
No.
Why? To what end?
Right.
Except to provoke and scare the hell out of her. And so, and I even had her I refrained from using the word frozen shoulder.
Yes.
I liked what you said, a little bit of a stiff shoulder.
Yep.
Is it stiff because muscles are holding, or is it stiff because there is a problem in the shoulder, in the joint itself?
Mm-hmm.
And she was able to kind of think that I don't think there's a problem inside my joint, because why would I be able to move like this?
Right.
So I said, well, I think it was the whole muscle holding kind of guarding thing because of the sensitivity in your nervous system
Yeah.
that might have been kind of what your was driving your pain experience a little bit here. So and because I think that we have to get away from words like frozen, because
Yeah.
that
Yeah.
That sounds horrible to
I know,
me.
I know. It's
And
that is a nocebo, as we say, versus a
yeah,
placebo.
right,
That's a definite nocebo. And
exactly.
I think all this, we learn in school all these tests, and which are great to learn, but
Hmm.
ultimately, in the end, I would say before any of you do a test like that, will it add to your clinical reasoning? Will it add to the
Exactly.
overall picture? If it
Right. And
doesn't,
hmm
then why do it? That's
yeah,
my
is it going to
opinion.
add, in this particular case, it wasn't going to add anything. If this had been
Right.
a volleyball player that just came off the court and, oh my God, I don't know what I just did to my shoulder, then
Yeah, of
maybe that's
course.
the place for some of those tests. It's like, okay,
Yes.
let's see real quick, because, volleyball is going to be, we know the
Mhm.
mechanism of injury can oftentimes be labral,
Yeah,
so,
yep.
so if it fits, we need to have those tests in our
Mhm.
arsenal. And,
Mhm.
oftentimes, people will come in a couple of days later thinking, oh, I just thought it was sore, but now, boy, I'm just clunking like crazy. And it's like, so let's see in the range where you're clunking.
Yep.
I think that that's important, so important. I don't want people to walk away thinking we never do special tests, or
Yes.
just
No.
have to kind
No.
of pick and choose the right time to do
Time.
them.
Yes, and the
Mhm.
right patient, the chronicity of the problem. Yes, I agree totally. I mean, I did some years
Mhm.
ago. I volunteered at a like a triathlon here, and those tests came in very handy when those people were coming off the race. So those are great to have. But when someone with a presentation like this, not sure it really adds to the clinical picture. So
Yep,
so this was a good one. I like it. I thought this was awesome.
it was.
I really think that's great about introducing movement in a non-threatening way, and the way you just approached it. And uh, because once you start doing all these tests and having her move hand behind her, but you're just flaring it up. And I think with someone like that, you need to flare that person down, for
Hmm.
lack of a better word, or deflare, unflare.
Hmm.
And sometimes less is more, especially
Yeah,
with these people.
exactly. This is a typical case where
Yeah,
somebody who kind of pushes her way through life, where less is really definitely more for her.
yeah.
And, once she got to where she was not afraid, and, that she wasn't getting a pain response, I mean, she self-loaded.
I
Usually
know. Bam, right to
I'm
the plank.
convincing people to, like, it's okay to load a little more. Let's load more. Let's load more. Because I think we baby people so much
Yes,
sometimes. But
yes.
I mean, she was like, okay, did you have any symptoms? Nope. It's like, rock on,
Okay, that's awesome. Well
so,
done.
all
Great.
right.
Cool. Well,
Okay, thank you, everybody. I hope you enjoyed this. I always enjoy spending time with Erica and having time to talk through stuff.
yeah, it's great.
We both learn a lot from each other, and I learn a tremendous amount from all of your questions as well. So keep them coming, and we will see you on the next podcast.
Podcast. All right. Bye, guys.
Bye. Thank you.
Bye. Thank you.